Hello, my name is Mariah, and I will be talking about my vertical sleeve gastrectomy surgery, which I had on May 22nd of 2020. So I'm about a week post-op at this point, and I'm going to be filling in the gaps between some clips that I got while I was at the hospital. So to start out, in case this is the first video of mine that people are seeing, my highest weight was 322 as of November of 2018. My starting weight on May 8th, the beginning of my pre-op diet, was 319. And then my weight at the day of surgery was 305 pounds. So I lost 14 pounds on the pre-op diet. So I'm going to be talking in between clips here and there to just kind of give a better, fuller picture of surgery and how that went for me. Alrighty, surgery day is here. I leave the house in about 45 minutes to head to the hospital. I just took a shower with antibacterial soap, so now I smell like a grandpa, but it's okay. I feel very squeaky clean. I have my bag packed, my CPAP packed. I'm saying goodbye to my cute dog. I'll miss him. It's only for a day or two, but he's very cute. Sorry, I'm not very good at holding the camera, but I hope to make this an edited video. I've done that in the past, but it's been a long time. So we'll see how that goes. I'm sure the next time you see me, I'll be miserable, but in a good way. I got myself a little bit pumped this morning watching cross-country horseback riding videos and just dreaming of the day that that'll be me, and hopefully not in the very distant future. But yeah, I'm excited. I'm nervous, but I'm excited. Here we go. Okay, so I arrived at the hospital at 11 a.m. and they quickly took me to the little check-in desk where we paid the copay for my surgeon, and then we waited in the surgery area for me to get called back for prep. So they called me back. My mom was the one who brought me to the hospital. Due to the coronavirus, I could only have one visitor and I could only stay for 24 hours. So 24 hours once we got into the room. So she was waiting for me while I got prepped. They took me back. They tested my urine to make sure I wasn't pregnant. They had me change into a surgery gown and lay on the bed they'd wheel me in. And they gave me a nausea patch to go behind my ear and a couple medications to help while I was under anesthesia and to help with pain. And they gave me an IV. Honestly, that was the part that I was the most nervous about because I knew after I had that IV, I'd be asleep. But I'm not like super scared of needles, but I just don't like feeling them like while they're in my arm. I know that's gross, but I had to get stuck 3 times. I still have a gnarly bruise from this. They just tried here, and then they finally got one on this hand. And that was not fun, but it was fine. And then they had some like relaxing drugs already going in the IV, so I was already feeling more calm at that point. They had the anesthesiologist come in and talk to me and just make sure everything was a-okay there. And then my surgeon, Dr. Bovard, came in. He talked to me just to verify what procedure that we were doing. He was funny. I was nervous. He was like, "What procedure are you doing today?" And I was like, "Vertical sleeve gastrectomy." He's like, "Okay, good. I know how to do that one." He's like, "How are you feeling?" I was like, "I'm nervous." And he's like, "Why? You get to be asleep. I'm the one that actually has to do it." So he's funny. But I talked to him briefly, and then my mom came in to say goodbye. See you later. She took my glasses, so I was blind. And then they wheeled me off into, I don't know if it's where they did surgery, but a room that had lights above me, and it was weird. And I was starting to feel loopy from the IV. And I remember, like, vaguely remember them having me, like, sit up and scoop my boot onto a different table and then putting some, like, weird stuff under, like, pads under my shoulders and then putting, like, a gas mask and telling me to breathe deep out after that. And then I remember starting to wake up in the recovery area. I could hear, like, the nurses and whoever, I don't even know, were talking to me. asking me if I could hear them and I remember hearing people talking about my blood pressure and saying that it was good, and just saying that I was groggy and taking a while to come out of it, and I definitely was. And I don't know how long that was. Apparently, it took me about an hour and a half to 2 hours to come out of anesthesia, to the point where they would put me in my room. And I think that's due to the fact that I haven't really had a major surgery like that, except I had my tonsils out when I was 7. And other than that, I haven't had too much experience with anesthesia, so I think my body was just very shocked by all of it. So I remember starting to feel like tenderness and tightness and soreness on my stomach, and they took me into my room, and then I remember going in the elevator, and there was like a nurse at the foot of the bed, a nurse at the head of the bed, and they were both wheeling me. And I was dramatic when they were like, "Hey, it's gonna be a little bumpy," and when I like got into it did hurt, but I think it was like a lot of just being out of it. But when they wheeled me in and like we went over the little bumps, I was like, ooh. I finally got into the room, and I was in there for a little while before my mom came up, and I think it was about 5:15 p.m. when I finally started like being like, okay, I can like comprehend what's going on around me. And I had surgery at 1 p.m. So yeah, so I think I have some video clips of after that you can watch now.
Hi, Mariah. Hi. How you feeling?
Not great.
What do you feel?
My back is achy, my stomach is sore, and I feel like I want to breathe more, but it just hurts. And I'm thirsty, but it hurts. But I'll be okay.
Yeah, you'll be fine. Well, you've only been awake for a little bit. Maybe 30 minutes. Surgery went well.
That's good.
As good as it could have gone, he said. Quick and easy.
Yeah.
So, lots of rest. You gotta be so gentle to yourself.
Okay.
Go to sleep.
Hello. I look a little rough, but it's okay. I'm feeling better. It's 7:14. I went into surgery about 1 p.m. and I've been awake and aware for about an hour and a half. At first I was feeling pretty miserable. I had ice packs on my stomach to help, but they were honestly more painful just because of the weight. So we took them off, and they gave me some meds in my IV for nausea and pain, and they're definitely helping. I've been able to have 4 cups of the fluid in an hour. I just finished this cup of protein fluid for my first 15 minutes, so that's good. On track to get my fluids in. My mouth feels so dry, but other than that, I feel okay. Things are going pretty well. I've been awake for about 4 hours. I've been able to hit my fluid goal every hour, so that's a blessing. I haven't really had pain with my stomach. I've had pain with the suture sites, but that's to be expected. But the nurses here are taking really good care of me. My mom's taking good care of me. So yeah, I just got this. Oh, hold on. Jeez Louise. Every time I try to grab it, it goes further away. This breathing thing, and based on my height and age, I'm supposed to get it to about 2,250 milliliters of inspired air. So I did it for a few minutes ago, so I'm about to have to do it again. It's not fun, but it's okay. It helps you not get pneumonia, which is it's a blessing. So then I'm about to go on my first walk here soon, so that'll be fun. I had a friend chocolate often.
Here's our little patient, just 5 hours after surgery. She's already doing laps.
I'm waddling like a penguin.
She's Crushing it.
There's stuff behind you, so be careful.
Oh, thank you.
You just came out of surgery today, right?
Mm-hmm.
This is good. This is really good.
I have surgery
Okay.
at
Should we go
once.
this
Do
way?
you want to be an overachiever? Do you want to go around it like this, or do you want to go around it the other way?
Let's overachieve.
Okay, good.
Could have told you that.
Hello. It's the morning of day 2, or yes, technically day 1. Surgery is day 0. It's 7:02 a.m. I've been awake since about 5:15. I used the bathroom and went on a little walk. And this past hour, since 6 a.m. to 7 a.m., I've just been working on my fluids and my breathing thing. I'm supposed to do that 10 times an hour, so every 6 minutes. And then I'm supposed to have 4 little 1-ounce cups, 1 of protein liquid and 3 of water. This is the protein liquid that I have. It's pretty good. It's a peach flavor, not too sweet, but things are going pretty well. I have yet to pass any gas, but I can feel it, working on it, feel the little bit of tightness, but my pain's been really well managed. So I haven't really had issues too much, unless I'm like getting up or sitting down. It's kind of tender. And when I was walking around, it was a little tender, but nothing unbearable, no bad nausea or anything. So I'm grateful for that. But things are going pretty smoothly. I'm grateful. Didn't sleep super well, so I'm a little tired. My mom is passed out over there. Yeah, that's the gist of it. Hello. I'm back home. I got discharged from the hospital at around noon on May 23rd. So less than 24 hours I was in the hospital. I was feeling really good in the hospital. I felt okay to walk. I was doing good with my fluids. Still haven't passed gas, which is coming to bite me now. I have some tight stomach pains that are just not fun. But other than that, I feel okay. The pain's definitely worse without the IV drip of Tylenol, and I think today they gave you some oxycodone and some other thing that started with a D. I don't want to say Diplo, but I feel like that's wrong. It's definitely harder, but I was able to get a little bit of a nap in, which was nice. I'm trying to stay up with my fluids and my breathing machine, watching for signs of dehydration. But I don't feel good, obviously. It's not easy, but I don't feel terrible. So, All right, so once I was home, I had to make it my full-time job to make sure I was getting enough fluids and trying to get enough protein. The first couple days were the hardest. I had a lot of pain because I hadn't passed any gas, and there was a lot of pressure. But these are the notes that the kind of spread that I made. So I'd track the hour and then what kind of fluid I had, how many ounces, and then this is how many times I did my breathing machine. As you can see, that day was a little bit crazy. And then tracking, like making sure I took my medications and my vitamins. So I was given like liquid acetaminophen, Tylenol for pain, that I could take every 4 hours as needed. And then I was given Zolfran for nausea that I could take as needed. And then I was prescribed Eliquis to prevent blood clots and omeprazole to help with acid reflux. So, and then I had to take vitamin B complex. So those are the things that I have to make sure I was taking. And I tried to take notes. It was weird because they tell you a lot that like the protein and things you like before surgery, you very well may not like them after, and that was definitely the case for me. Before surgery, my favorite Premier Protein shake was caramel, and after, when I tried to drink it when I got home, it was sickly sweet. Like I couldn't stomach it. Like it was really grossing me out. So I had some of the light blue, like non-fat Fairlife protein-y milk that I diluted the protein shake with for the first day, which was nice. And after that, I got, my parents got me some of the Core Power Fairlife protein shakes that are just like not quite as sweet. So those were nice. But yeah, each day got a little bit better. I've been staying with my parents just because my husband works weird hours and be able to have somebody to help me. Because I was definitely very dependent in the beginning. My parents are working from home full-time right now, and my little brother, the school being canceled, is home. He's 9 years old, but he was very helpful with helping me get in and out of the recliner, helping me put my socks on, helped me get a blanket. So he was cute and helpful. But yeah, it's been a little bit of a roller coaster, honestly. Sometimes I feel better than others. It definitely caught up to me, and on like day 4, 2 days ago, day 4 post-op, I was a mess. Like, I was crying all day. I was just really emotional, really in my head, like kind of just feeling depressed, honestly, and it was weird. And I think it was just a culmination of all the meds I was taking, the stress my body was under, everything, and just like really overanalyzing everything, because I'm used to being pretty helpful around the house and helpful with my family, and just feeling like bedridden and just like a lump that couldn't help with anything was stressful for me. So thankfully my family and my husband were nice and just helped me get over myself a little bit, and we watched some funny movies and I got a little bit better. But yeah, things have progressed with my protein intake. I talked to my nutritionist, and she said just to make sure I'm getting my fluid intake. It can take a while to get your protein intake in, but that's okay as long as I'm at least getting the fluid and not getting dehydrated. But another big thing, I was told that I could take Miralax in case I was having issues with constipation, and I definitely have been. So I took that yesterday, and it finally is starting to help, but it's no joke. Like, with all the protein and then all the medications, it definitely stops you up a little bit. TMI, but it's true, and it's a little bit painful. I would definitely recommend the Miralax. It's kind of gross. It doesn't taste, I got the Equate brand, and it doesn't taste like anything. It just like thickens the water. So it's kind of weird, but really not that bad considering, and it definitely did help even though it took a while. But as of today, I weighed myself, and because I finally had a bowel movement, so I finally wanted to see if there was any weight change, and I was at 300 pounds, so 300.4. So I'm 5 pounds down since surgery, and I'm still super swollen, so that's exciting. But yeah, I'm finally starting to feel better. As of yesterday morning was the last time I took Tylenol. I took it at 6 a.m. because I woke up with some gas pains in my shoulder. Those are no joke. When they say that those hurt, they really do. I woke up with some gas pains in my shoulder, and so I went downstairs at 6 a.m., took some Tylenol, and fell back asleep in the recliner. But then after that, I didn't take Tylenol or Zolfran again, and last night was the first night I was able to sleep without any Tylenol. And I was actually able to sleep like somewhat normally. Before that, I had like one of those back pillows with the arms and like a few pillows stacked up like on a ramp. But last night I laid flat, and there was some pain in my incisions, but not much. And I was actually able to get up pretty easily today. I feel like I only really feel pain when I am standing for long periods of time. And it's, again, on that divoted incision that's really swollen. The other incisions don't tend to hurt too bad. But yeah, that's about it. I'm grateful to be where I'm at now. It definitely hasn't been easy, but it gets better every day. And I mean, make sure you're walking around and staying mobile as much as you can, but it's okay to take naps. It's okay to relax and just take care of yourself. And yeah, I'm grateful already. I'm excited for, I already feel like my face is quite thinned out. I mean, I'm 19 pounds down from when I started the pre-op diet 3 weeks ago, so that's exciting. So I hope to do another update soon after I meet with my surgeon for my 2-week post-op diet, or 2-week post-op appointment. But yeah, for now, I'm just starting to feel a little better, so hopefully we'll get a little bit more activity and really just walking. As of yesterday, I started to feel well enough that I was actually like craving other foods again, which was interesting because the first couple days after surgery, when my family would make food, I would get so grossed out, like it would make me nauseous. But last night, like, foods are actually sounding good to me. So I think it'll be a little bit hard because my body is definitely like in starvation mode right now with having this recovery, to really make sure that I keep the mentality of like, this is a lifestyle change. I'm going to eat healthy once I can eat food again. And just looking forward to the next phase where I can start having like refried beans, yogurt, other things that are a little bit more substantial. But yeah, thanks for watching. Sorry for the ramble. That's how I am. So yeah.